As I was sort of writing this down, I want to use these two experiences to sort of remind myself that it's not okay to be desensitized to these situations. Patients are suffering, and then we really must use experiences like this to remind ourselves about that this is someone's life, this is not okay, and then use these experiences as an impetus for action.
Why should I hold on? Are you trying to delay my healing? Healing that has been delayed, and now I'm the only one to suffer for yet another person's error in response. We stand so tall and strong through the pain, and we get told to hold on. Hold on to what, though? When we have to stand using our own 2 feet, feeling as if there is no one else to hold on to.
And I asked her, how are you sleeping at night? And she finally started to kind of get some tears in her eyes as she told me that sleeping was tough because she was sleeping on the bus because she didn't have anywhere to go home to. And gradually her story unfolded from there.
I know that because she is Black and she's under constant stress at home, these adverse experiences make her at much higher risk for overall mortality. It is likely that she has had many other adverse experiences growing up, experiences that create chronic stress and can manifest as a serious medical problem.
And it would have been easy to blame her for being in the hospital without considering the many factors and reasons that may have led her to misconceptions about her condition and her need for medications. But taking the extra time as an opportunity to get to know her and to educate her, help improve her understanding as well as mine.
In order to achieve health equity, in order to allow this patient to attain her full health potential and not be at a disadvantage, this home visit wasn't above and beyond. It was the baseline that was necessary and something that should be standard and routine for her and for patients like her. And accordingly, it should be standard that we as providers are given time and resources necessary to fulfill our patients' needs.
So equity means the hard to diagnose and the difficult to treat must have a means to find answers and treatments that come so much more easily and rapidly to those with more common ailments.
The fact is that we provide the resources that we can in the moment, but there's always an entire floor of other patients to care for. It was late and she and her son were safe, but that wasn't enough. I'm here learning about advocacy work so that in the future I can better direct these families to resources and support services that they need. With time and dedication to patient advocacy and policy work, we can change our world for the better.
In addition to all of the systemic changes that need to happen in the name of health equity, how our individual efforts provide care that meets the patients where they are adds to that common goal of creating a more equitable healthcare system.
It's getting now to early spring, and I think emerging through this now for a year, I think we could get it right. I think we will get it right. Will we get it right? That's my story.